I asked an older cancer patient of mine to draw a clock for me. He got frustrated about why the test is needed. I explained to him, and I will explain to you. Hi, this is Dr. Armin, Shahrokni, a geriatric oncologist. I have 12 years of experience of taking care of thousands of older adults with cancer. The clock drawing test is a cognitive screening tool. It's been used for many years, in fact since 2000. It is quick and easy to administer, and that's why many clinicians like it. We ask you to draw a clock, then put the numbers in, and then put the hands in a way that it shows 10 past 11. It seems easy and straightforward, but it is not. Let's go over the process one by one. I tell you that I want you to draw a clock for me. With this simple instruction, 1. We are testing your hearing. You need to be able to hear. 2nd, you need to have enough attention span that is a clock, and likely other instruction will come after. 3rd, you need to comprehend the instruction, which is draw a clock. Then you will draw a clock starting by drawing a circle. That circle could be very small, or that circle could be very large, or it could be of a normal size. We also pay attention to your drawing. Is your hand shaking? Did you more or less draw a face of the clock, or it was something else? Then we ask to put the numbers in. Here we are testing your executive function and planning. You need to put the numbers like a normal clock. We are also testing your visuospatial ability, an ability to put the numbers within a relatively similar distance from each other and reach 12 at the end. Now some patients do this perfectly. How? They first put 12, then 3, then 6, then 9, and then they fill the rest of the numbers in each section. In some cases, the patient continues to put the numbers in without paying attention to the normal form of a clock. In some cases, the patient puts all the numbers in one half of the clock. And in some other cases, patient starts by putting the numbers correctly and then gradually make mistakes. After putting the numbers in, we ask you to put the hands in a way that it shows 10 past 11. Why we ask it that way? Because now the patient must analyze which hand has to point to what number. Should the long hand point to number 11? And then what about the short hand? The clock is supposed to show 10 past 11. So does that mean that the short hand should point to 10 or 2? As you see, a clock drawing is not a simple task. Many times, patients get frustrated because they think they are unable to do a simple task. But the reality is, a clock drawing involves multiple domains of your brain. Now it's important to mention few very important points. Your ability to draw a clock might be impacted by a variety of factors unrelated to your cognitive function. Let's say you're extremely anxious, or you're just diagnosed with cancer, and there are so many things in your mind. As a result, paying attention to a proper clock drawing is not your priority. Second, it's important for the care providers to explain the importance of clock drawing test, so you try to pay as much attention as possible. Third, clock drawing test is just a cognitive screening. We are not diagnosing you with cognitive impairment if you fail the test. The most important utility of this test for you and the family is to know that there might be some degree of cognitive impairment, and more comprehensive testing might be needed, especially if it's aligned with your goals. So in summary, don't assume clock drawing is easy. Don't be frustrated if your clock drawing is not perfect. Don't be alarmed by an abnormal clock, especially if you continue to manage your daily life perfectly. And think with yourself, when was the last time that you presented to your cardiologist and cardiologist did a test and found out that you might be at risk for future heart attacks? When you come to a geriatrician, clock drawing is a test that may help you and the family in the future by seeking care sooner rather than later. If you enjoyed this video, I appreciate if you like my video, subscribe to this channel, leave a comment below. The goal is to provide global geriatric education for the global aging population. See you in the next video.